There we go. All right, guys. How are we doing today? Good? Real good?
Good.
Awesome. Glad you guys could come. Great. My name is Matt Rector, the South City Fire Department. What I'm here to talk to you guys today is all about Cpap and how you apply that to your patients. When you look at your handout that I handed out for everybody today, it's kind of just gives you our goals, objectives for today, and also on that back piece of paper gives you some details. A nice little article I printed out from ems1.com, and it talks about managing Cpap and stuff like that. So it's a little bit further read, a little bit further detail into kind of indications, contraindications, and stuff like that. As the main focus, I'll talk to you guys about kind of what you should look at when you see Cpap, what indications, what contraindications are there. Also, be able to put together your Cpap. Also, fitting it onto the patient. We'll talk about different types of Cpap settings and stuff like that, and then also applying it to your patient, and then what you should see when you apply that to the patient. Is that working for the patient? What are we doing? Do I need to take it off? And stuff like that. So moving forward, what is Cpap? Cpap is a non-invasive method to provide respiratory support to certain patients. Cpap has been shown to rapidly improve vital signs, gas exchange, the work of breathing, decrease sensation of dyspnea, also decrease the need for endotracheal intubation in the field, also helps to improve shortness of breath related to congestive heart failure and acute pulmonary edema. So those are going to be your two things. By the way, before I go on, this PowerPoint, was provided by Pulmodyne. This is actually the company that we use for all of our products for Cpap. This comes from them. They have some few things in there a little different than what we operate off of. Remember, we operate off of Nebraska protocols, but Cpap is pretty much used throughout the country, and their contraindications and indications are pretty much the same as ours as well. So moving forward again, Cpap has been successfully demonstrated as an effective adjunct for management of pulmonary edema secondary to congestive heart failure. What Cpap does is it allows or buys time for administration of other drugs. You'll find out with Captain Lance here that when we get working and securing the patient, he'll actually improve his breathing and stuff like that. So moving forward, so your lung inflation, what happens is how Cpap works is it works by providing increased continuous gas pressure, so it's constantly pushing air into your lungs. It's going to help expand your alveoli. It's going to go ahead and displace any of that fluid, and then be able to make connection with the capillaries that are in there, and then get that proper exchange. So, so you'll see here, you got some issues, and there's some space. It's going to expand, and then so you're going to increase in tidal volumes and stuff like that. Your Cpap mechanism, what it's going to do, like I said, is it increases the pressure, allowing for better gas diffusion and for a re-expansion of your collapsed alveoli. It allows for refilling collapse and airless alveoli, and then it actually expands the surface area of the alveoli. So as you can see here, when you get in down here in your capillaries, here's your capillary right here, your alveoli right here, then your capillaries are these little guys right here. So right now, if I don't have any Cpap on, I'm not making that connection because outside here is fluid. Okay, so I got fluid surrounding everything, and I can't make that connection. So your guys, anybody who's going to feel short of breath, he's going to get increased respirations, he's going to feel that panic and stuff like that. Well, what we're going to do with Cpap is it's actually going to continuously inflate our alveoli. So it's going to help keep that constant inflation and help expand it. What that's going to do is it's going to displace or move away the fluid in there, and then it's going to go ahead and help make connection with our capillaries. So it's just went from here to here real quick. You're going to see that exchange a little bit better. So the goal of therapy with Cpap is to increase the amount of inspired oxygen. It's going to decrease the work of breathing. In turn, it's going to decrease the need for intubation. It's going to decrease your hospital stay, and it's also going to decrease the mortality rate as well. Okay, so Mr. Captain Lance here will be able to survive when he gets into the hospital. That way I don't have to intubate Captain Lance as well. Okay. All right, so when we get on scene, our contraindications for our O2 rescue system are going to be pneumothorax, so any sort of trauma We got seesaw action going on in the ribs, stuff like that. I got decreased lung sounds on the right side versus the left side. Hardly any air movement. Probably going to want to hit towards maybe a thorax, maybe a whole nother procedure on that end. Or anybody who's got decreased cardiac output and gastric distension. So in order for this to work properly, is I got to have a heart that's perfusing and a blood pressure. So that means a blood pressure over 90 systolic. That what in turns is, in order for me to get proper exchange into the blood, I got to make sure that blood's pumping. Okay. Also, anybody who's got any sort of severe facial injury, why wouldn't I be able to? Does anybody know why I wouldn't be able to put a Cpap on somebody who's got deformed face, trauma to the face, or anything like that?
Not going to get a good seal, or you may have obstructions to begin with.
That's right. You're not going to be able to get that good seal. You might have this might not be right. Somebody might had a past suicide or something like that, and their jaw's displaced and stuff. So any sort of significant trauma to the jaw, to the face, anything like that, you might not be able to get that good enough seal. Plus, you got to tighten this on somebody, so you actually could do more damage than good. The other thing is anybody who's in respiratory arrest. In order for Cpap to work properly, they got to actually be breathing. Okay, so we'll go through that in our indications, contraindications as well. And then anybody again who's hypotensive, secondary to hypovolemia. So if anybody's in a trauma, they're bleeding out, getting some of a respiratory distress. Again, we get into that hypotension and stuff like that. You don't want to put on Cpap. That's not going to help that patient. So the requirements for Cpap. The real requirement for continuous constant positive rate pressure with minimal fluctuation in system pressure between inspiration and expiration. The constant pressure will help reduce the patient's work of breathing, which is important since it reduces the resistance of airflow in the present lung disease. Okay, so like I said, Cpap helps keep that inflation, keep that connection, and does wonders for that patient. So here's our O2 rescue system. It comes in different pieces. You got your head strap, you got your face piece, and then of course you got your air filter and stuff like that as well. As you can see, connection to the O2, you got your filter, you got your tubing, your mask, your actual pressure right here, and then tubing, your face piece, and stuff like that. You got your fixed, again, we'll go through the little details. Fixed flow generator with filter is right here, your filter. It's got a 72-inch corrugated anti-asphyxia circuit. It's got a O2 Cpap valve, mask and head strap, single patient use only. This only goes on one patient. When they get this put on them, it's theirs to keep. We don't want them. We don't reuse them or anything like that. This is theirs. So here's basically your high flow generator. We hook up our O2. You get your air intake, presses down, pumps into the patient. Basically what it does is our venturi tube ratio is 10 to 1. The flow is up to 140 liters per minute at 30% FiO2. And we usually hook up to about 50 psi oxygen source. With any standard ambulance or cot bottle or anything like that, you're going to have that 50 psi on top of that. It's got a built-in built-in filter to protect that device as well. Moving forward, the valve on here, so it's got a valve where you can set it up to your pressure. We start ours out at 5, and ours isn't exactly like this with the 10. Ours you can actually dial down. It starts at 5, goes to 7.5, and then 10 right after that. It's got an anti-asphyxia valve, so that way when the patient's breathing in and they go to exhale, it goes out the side, so that way you're not rebreathing anything like that. So it kind of works like a non-rebreather. It's got a little flappy valve on there, so that way you don't have to inhale that expired O2 that you just did. So it's got different options for us. You got your seal mask and head strap. Comes in adult, large, medium, and small. These are fixed right here on top. You can't adjust those, and your mask is there, right there. You got your air mask and head strap, different types there. Our soft mask, so it's got a little extra bit of a soft barrier right here. Again, they come in 3 different sizes. All of them are pretty well much the same, except for the head strap part. That's a little bit different. This is actually the one we use. We use the Vitrek ED mask and head strap. This is adjustable right here. I can pinch and slide that up and down. Okay, that way, because anybody's face is different from mouth to forehead, I can adjust that accordingly. It comes in extra large, medium, and small. And it's got dual positioning tabs, so we'll show you the guys that here in a few minutes. So here's just a regular shield. This is good for people with beards and stuff like that. Facial hair just goes right on there, kind of smashes on as well. So the accessories, again, these are the different types of adapters you can switch on so it adjusts, but ours is just a dial meter, so it goes from the certain pressure. It can go from 2.5 all the way up to 20. Ours just starts at 5 and then works for 7.5 and then 10. So just also too, ours that we buy comes with our T adapter, which I'll show you here in a few minutes. So we can actually be able to give drugs through ours as well. We can actually pump in albuterol or Abduloneb at the same time we're giving it. So you'll be able to hook that up, fill up your drug, connect it on, and help that patient even more through our little adapter we got here. It's got a rescue filter on it as well. Helps keep bacteria out of there and works well with patients. Ours doesn't have that though, but we can get ours with it. We just choose not to because they're on it for a short period of time. This would be some people who have long distance transports. This is what you'd want to have on there. It kind of positions on just like this. Looks like so, a little disc in front of there. Not exactly the most visual appealing thing in the world. But so what we'll do is just kind of talk about the hookup. We have the same connection, Christmas tree. Your O2 bottle's got to have this special adapter on it so it connects up. Ours is real good. All you got to do is make sure your bottle's on. Connect your Christmas tree like such, like we have here. You connect this to your Christmas tree on the end, and then go ahead and screw it on, okay? And then what it does is it automatically turns on. Question?
Oh, I was just telling you were burning through a couple slides.
Oh, did I? Oh, okay. Oh, this stuff, D-cylinder and stuff like that, we're not going to worry about that.
Okay.
We'll get on to actually, this is our main step, okay? So, what this is going to do, step by step, is we're going to talk about what we have to do first, okay? So, what we need to do when we put on our Cpap is, we need to make sure we find the right size mask. What I do is most people are usually a medium to a large. Don't really come across a whole lot of people that are smalls. But right here we got our mask and we got our little, as you can see right here, we can squeeze and adjust this headpiece up and down like such. We got our pieces, whoop, broke. That connects on right there. You got your extendable tube, steps out just like this. Then you got your adapter. This goes to the face piece right here. Okay, so you can take that, be able to connect it on just like that. Then our dial right here on the sides got 5, 7.5, and 10. We leave our setting at 5, and then we go adjust from there. So if somebody's still not catching on, you can adjust the pressure and go from there. You don't want to start at 10 and have to back off, start at 5 and increase as needed. Okay, so basically again, I'm going to step around here the dummies so that way I can show everybody. Our first step when we put on the Cpap for this patient is make sure our patient is sitting up. The dummy here can only sit up so far, so we got to make sure he's sitting up. The first thing you got to do is you got to flip your head strap over so it is like such. Then make sure your tubing, first you got to connect your tubing to your O2. So you turn that on, you turn that O2 up to 15 liters per minute and let that flow, and then go from there. Make sure your setting is at 5. Then you connect your setting and put it on to your mask just like that. Like I said, you got this flipped over so it's on the other side. What you do is now you got this flipped, you press right here on the match, line it up on the bridge of the nose and down on the mouth. Then you take your forehead adjuster and your mask adjuster, get it lined up so it's just above the eyebrows. And this is kind of a squeeze and pinch. You can actually move it forward or backwards, and so that way I have to hold it on the that pressure. If I need to relieve it, I can press the pin and have it back out just a little bit too. Okay, and I'll have everybody come up here and do this in a second. So once you get this adjusted on it properly and accordingly, what you'll do next is you'll flip this over on top of his head like so. So this is all flush up against the back of his head, or your patient's head I should say. Get your straps around here, okay? Then you got your little clips down here. You hit your clip on one, then you grab the other one, and you reach and you have your clip on, and you have it clip right here on this corner, just like on the other side, okay? just like that, all right? Now you might have to ask the patient to kind of hold on for you, or if you have your partner available, what I'll have him do is I'll have my partner hold on as well, and then basically tell the patient, okay, this is what we're doing. We're gonna put the mask on, this has gotta stay on, and then this is gonna help you breathe, okay? So just breathe nice and easy with the mask, okay? Don't force it. They might toss a turn, they might not like it, but just coach them down, let them know that you're gonna be there and take good care of them, okay? To adjust these straps accordingly, what you need to do is you need to unstrap them like this. Then what you can do is just hold here. You can go ahead and pull this tight, and then have your partner on one side, hold it, strap it down, and then strap this down along that same Velcro, okay? And then the same thing on the bottom. If you gotta make sure you got no air coming in through here, then you do the same thing on the bottom. You adjust the strap accordingly and make sure it's flush. So you wanna have a nice seal around the face and come up around the bridge of the nose and down around the chin, okay? A lot of times you wanna get these on your patient, then ask them 100 questions. Well, you can't really talk because when you hook this up right here to the end of your O2 tank, this makes a horribly loud noise. It's gonna be like a high-pitched scream, okay? Then what I need you to do is, after that, 1 second. Code 1. All right. So once you get that put on, what you're going to do now is you're going to monitor your patient. You're going to go ahead and, you're going to check vital signs. You're going to check your SpO2. Make sure I got an increase in SpO2. Then after that, you're going to check heart rate and stuff like that. Double check lung sounds. If you need to, you're going to fill up your O2 or your drug like such. Okay? You're going to hook that on like such. Then you're going to hook this onto your end cap right here. And then what you're going to have to do is you're going to have to actually take this and you're going to have to connect this into your O2, set that to about 6, and then go from there. Okay? So once we have that done and completed, if there's any indications, if he starts to go unconscious, lethargic, or anything like that, then you want to recheck patient's vital signs and go from there. You want to coach the patient down. You want to tell them, hey, what's going on? It may produce some anxiety. Verbally coach the patient's nice deep breaths into their nose, out the mouth. Take that anxiety away from that patient as well, okay? Then Cpap versus intubation. Intubation is Cpap's non-invasive. It's easily discontinued. It's easily adjustable. EMT basics can use it as well. Intubation is invasive. Usually doesn't extubate the tube in the field. You can get lots of infections. You might miss. It is very traumatic for the patient as well. So that's the end of that slideshow there. If anybody has any questions or anything like that, please come up. We're going to go through it, everything step by step. We're going to have everybody put this on and take it one at a time and go through there so we all know exactly what's going on. So after that, we'll move forward and go from there. So, like I said, we'll go ahead and take some time and we'll get this going. All right?